continue to increase the confirmed cases in Nanjing. Now we enter into a critical time, and today we are holding the press conference to release the latest information and update on the latest concerns. And with us today we have the Deputy Director of the Municipal Health Commission and also Deputy from the Urban Management Bureau and also a Deputy District Head of Jiangning District and also the Gulo District. First, I would like to give the floor to the Deputy Director of the Municipal Health Commission, Mr. Yang Dashu, to brief us the latest situation. Friends from media, good morning. Now I would like to give you on the updates for the latest situation of the epidemic. First, the new confirmed cases. From 0 o'clock to 24 o'clock of July the 27th, Nanjing reported 47 new confirmed cases. 5 are confirmed cases turned from asymptomatic cases. We also reported 1 asymptomatic case. All these new cases are centralized in key control areas, and these confirmed cases are found from massive screening. And also we found close contacts and secondary close contacts. These people have been brought to centralized quarantine. As of 24 o'clock of July the 27th, Nanjing has a cumulative report of 153 local cases. 87 are mild conditions, 68 in normal conditions, and 4 in severe condition. We also have 2 asymptomatic cases. Among these 155 infected cases, and 122 in Jiangning District, 1 in Lishui, Xuanwu, Qinhuai, Xixia, Liuhuatai District also registered 1 confirmed case. And all the residents actually attach great importance to the circulation of the disease and the virus, and we also publish these details in a number of social media platforms of Nanjing Municipal Government. And also we will publish some of the epidemiological investigation and also to publish some facilities that have been visited by these infected cases. And also we will update you on the risk level in different regions. According to the epidemiological investigation, for most of these cases are found in the airport or nearby places near the airport. And among all the confirmed cases, we also see some cluster outbreak. So I would like to send out a reminder to the local residents. Please avoid gathering and do not visit your friends and family members. These are very important to prevent and control the epidemic. Of course, you have to wear your mask and mind your own safety and wash your hands frequently, keep a good ventilation, and also exercise social distancing. Right now, we are raised with the virus. Please mind your own discipline and mind your home hygiene. Also, please follow the prevention and control regulations when necessary in order to ensure your safety and reduce the risk of the cross-infection and reduce the infection rates and bring the patients to treatment as soon as possible. According to the number 6 notification published by the leading group of the epidemic prevention and control in Nanjing, we have to strengthen the management of the medical institutions, clarify the responsibilities for all the different medical institutions, and also to manage the nosocomial infection. And for all the hospitals, they will roll out the appointment system and they will not allow any visitors to visit the hospital to see their family members and friends. Once again, I would like to remind all the residents, if you develop symptoms, for example, fever, coughing, sore muscle, and other related symptoms, please report to the community and seek medical service to the nearby hospitals and clinics. Make sure that you do not take the public transportation to seek medical help. And also, please update your doctors on your travel history. Thank you. That is my update. Now I would like to give the floor to Deputy from Gulo District, and he will brief us on some of the service guarantee to the local residents and also the prevention and control measures. First, I will brief you on the information about the situation in Gulo. So according to the massive testing, initially we found 2 cases, and the infected case is a taxi driver. He used to take passengers from the Nanjing Lukou International Airport. Now he has been sent to the centralized place for quarantine. Our district immediately taken some of the actions. First, we will do a good job in the epidemiological investigation. And right now, we have bring 343 close contacts into quarantine. And also, we found secondary close contacts, 170 people. All these people have been sent to the designated place for quarantine. And just now, Director Yang updated us on the confirmed cases and the asymptomatic cases. And yesterday, we reported 2 new cases. For these 2 asymptomatic cases, they're actually living together with the driver Zhang, and also the other one confirmed case is a staff member in the airport. Second work we are doing is to roll out the massive testing. We are rolling out nucleic acid testing to 343 close contacts to Mr. Zhang, and also we found asymptomatic cases related to Mr. Zhang. And for the other people, all tests shows negative. And third, we are working on the disinfection. To this infected case, we will roll out disinfection to his residential building and places he had been visited. And also, I would like to update you on some of the measures taken by Gulo district, and we were focusing on the key population. For example, we will roll out nucleic acid testing to 1,000 people working in the airport. And also for secondary close contacts, we will bring them into the 14-day centralized quarantine. For low-risk population, we will roll out 7-day quarantine. And the second, we will focus on the management of the local communities. We will control the access for these people, and also we will set up the checking points. So we will check the traffic control on the transportation and the vehicles, and we will check their temperature, and also we will not allow the delivery person to enter into the local communities. Third, we will manage the public facilities. So right now, for all the 10 cinemas and the 54 web cafe and also certain stadium, we already closed cooperation for those confined places. And also we start the extracurriculum schools for the students. We also control the traffic for the shopping malls and grocery stores, and we will also encourage people to exercise social distancing. Now I would like to brief you on the service guarantee to local residents who are living in the Gulo district. We'll do our best to provide supplies to these people. We will have a point-to-point delivery and to provide services to people who are living in Gulo district. We will also provide guidance to these people to facilitate them with the medical service for pregnant women and people suffering from chronic disease. And we will provide emergency services. Second, we are doing our best to change the health code from the yellow code to the green code, especially for people who have traveled through Nanjing City. And also, we will manage the flow of people who are holding the yellow code for the Jiangsu health code. And also, we will focusing on the big data management. So in the online platform, we will also change some of the code for the local residents from yellow code to green code. And the third, we're focusing on the market supply. We will work with 77 grocery stores and also several wet markets to provide daily necessities to our local people. And also we are providing the market regulation to the market update and also the price monitoring of the daily necessities. Now is the Q&A session. Please identify your media affiliation before you raise the question. with China News Service. According to the regulations start from yesterday, for some of the pharmaceuticals in Nanjing, they start to provide medications relating to fever and coughing to the local residents. So how's everything going right now? If some residents need to have this medication, through which channel they could obtain this medication? Thank you.
好，这个问题请我们市场监管局来回答。
I will turn over to a deputy from the Market Regulation Bureau to take your question. Thank you for your attention to this issue. We have released the number 6 notification yesterday. For the Market Regulation Department, by no time, we have give a reminder to the 2,323 clinics and the pharmaceuticals to stop the selling of medications related to fever, coughing, and antibody and the antibody medications. And start from today, we will check on the selling situation of these drugs and the medications. We have our inspectors to visit all of those pharmaceuticals to check the situation, and also we have a remote system to monitor the list of the products for these pharmaceuticals. And for some of the drugstores, if they're not following our regulation, or if we found some illegal behaviors, we will handle those cases seriously. Here, I would like to remind all the local residents, if you develop symptoms such as the coughing, fever, do not purchase medications from the pharmaceuticals. Please visit one of the nearby clinics and the hospital to seek medical support. Please understand and support our work. If you find any pharmaceuticals selling these 4 types of drugs, please report these cases to us through the hotline 12315. Thank you.
然后我是新华日报交汇点的记者，就是有网友反映啊，在路口街道封闭区域内，就是发菜只发给本地人，发给外地人，
they're saying that for some of the delivery of the day supplies, they only provide food to local people, meaning that people with Nanjing residence, and they're not providing to people from other cities. And for some of the students, they have been staying in campus. How can we deliver food to the university students in Jiangning district? Thank you very much for your attention to the situation affected by the epidemic. For Jiangning district, we have 33 places with mid or high risks. In terms of the supplies, we're actually treating everyone as equals, no matter you're from Nanjing or other places of China, in order to meet the needs of people who are staying in Jiangning district. We have sufficient food and daily necessities, top 9,200 tons. In order to ensure the delivery for people who are staying in the risky areas, we actually setting up a transfer center in a logistic park, and we start to use this transfer station from yesterday. For the first batch of supplies, up to 687.6 tons of supplies has already delivered to the places with mid and high-risk regions. And this will accommodate these people for over 5 days. And of course, in the future, we will provide more daily necessities to these people. And also, we are receiving the message saying that students staying in the local district are not able to receive the supplies. We have over 200 students living in a high-risk region in the Jiangning district. Yes, indeed, we do have some challenge to provide food to those students. After we receive the notification, we work with the local campus and universities. We are able to deliver box meal to the students who are stranded in the high-risk regions. By taking this opportunity, we also try to find out some of the loopholes. We encourage the communities to find out more students who are stranded in those areas. In order to meet the needs of medical service for people who are living in the risky areas, we will also mobilize the medical resources. We are actually selecting 3 experts who used to support Hubei in the fights against epidemic. Also, we are organized a team of 5 experts from Jiangling Hospital. These people will station in the Jiangling communities. And they will look at the request of different residents and improve the capability in Lukou area to improve the capability to treat the patients in Lukou. And especially, we have to step up our efforts to early identify the fever patients. We are actually emptying one of the hospital so that we can bring severe cases to the Jiangling Hospital. We have 273 wards with 588 beds. We believe this hospital will meet the needs of people who want to seek medical help in Lukou area. And also, we will transport these patients to hospital for treatment as soon as possible. And also, for some patients, they may have hemodialysis request. We also have a point-to-point transportation of this patient. On 26th of this month, in Baiyunlu district, we found one patient, a woman, used to receive the hemodialysis treatment in Jiangling Hospital, but right now she's staying in a high-risk community. Considering the actual situation, we are transferring this patient to Lukou Hospital to receive the hemodialysis treatment. Right now, in Jiangling District, we are setting up the hemodialysis treatment room in 5 areas. And also right now, we are also increasing some of the equipment that are able to provide a hemodialysis check for all of these patients. Within 1 week, we are providing services, this hemodialysis treatments and services to 72 patients. And on July the 23rd, we are also opening up a psychological counseling hotline, so we are able to provide services to 588 patients. On the day we're opening these hotlines, we are providing the counseling to one specific patient. And this patient said she was quite panicked and she's not able to sleep because of the epidemic. For our counselor, they talk a lot about the family of this lady, and after 40 minutes of conversation, she feels more relieved. So this is our introduction in Jiangling District. Once again, thank you for your attention to the livelihood for people who are living in the risky areas. We will continue to bring more support and conveniences to people who are living in this area. Thank you. Next question. With Nanjing Daily, as of yesterday, we have 40 places with mid and high risk. So how we handle the garbages in these risky regions? How we transport the garbages in the city? Thank you.
好，请我们城管局回答。
I would like to give the floor to Deputy from the Urban Management Bureau to answer your question. Thank you for your attention to the issue of the garbage transportation and the clean environment of the city. Since the outbreak of epidemic, we are following the guidance from the leading group on epidemic prevention and control. Immediately, we come up with a contingency plan to handle the garbages in the city. First, we set up our working standards, and also we are sending out a guideline for local sanitators. And the second, we also organize a special task force. For this emergency task force, they have started their work in different districts of Nanjing. As of now, for the transportation of the garbages is handled properly, and on a daily basis, we will clean the garbages in different districts. On a daily basis, we are able to handle 8,100 tons of garbages. We have taken the following measures. First, for the control areas, the confined areas, we have designated personnel to bring the designated garbages to designated places. Second, during the transportation and collection of the garbages, we will clean the containers that bring those garbages, and also we will disinfect all of those containers at the same time. And for different quarantine sites and isolation places, for the garbages produced by the people who are living in those areas, the community workers will also collect these garbages on a door-to-door basis, and also they have bring special container to collect those garbages. They are using designated bags and containers to bring those garbages to other places for handling. Third, when we are collecting the garbages, we will provide trainings to the sanitators, and we have a very strict disinfection guideline. According to the new handbook and the guideline, we also have a detailed operational measure. For example, we specify the disinfectant that have been used to collect the garbages. And fourth, we also do a good job to protect our sanitators. We require these people to wear protective suits and wear facial masks and protective gloves and goggles, as well as protective shoes to protect themselves. Also, for all the protective gears, they have to do an overall disinfection to all of those gears. I would like to share one of the examples. So first of all, I will look at the situation of the risky areas, and also we will set up a special route to transport all of these garbages. And the second, during the collection of the garbage, we will disinfect all of these places. When we are collecting the garbages, we need to make sure that no other residents will come close to the operation site. And third, we will work on the disinfection. For example, we will disinfect the containers, bags, and the vehicles that will be transporting the garbages. We will checking the garbage bin, and especially we will focus on the cleaning and the disinfection of the cover of those garbage containers and the garbage bins. And when we are collecting the garbages in the community, for example, in Lishui district, for the garbage collection in the risky areas, for the sanitators, they will go to each household to collect the garbage. And the first, they will disinfect the garbage bag. And also, they will bring these garbages to designated transportation vehicle. And also, the local community will organize a special force to handle all of these garbages. And for the drivers and the community staff members, they will wear protective suits. Third, for people who are staying in the vehicles, and they will bring this to the garbage sorting station, And of course, they have to design a route to transport all of these garbages. We have to make sure that all the people involved will not have a contact of all of those garbages directly. And also the Prevention and Control Center also set up a task force, so they will roll out disinfection to all the public facilities in Nanjing City. And when necessary, they will provide support to handle the garbages in different districts in Nanjing. This is the situation about the transportation of the garbages. And for the handling of the garbages, we had 3 garbage processing factories. We also set up green channel to allow the vehicles enter into those processing stations. We also have 3 time slots in the morning, in the afternoon, and in the evening, so that these factories will receive the garbages from the risky areas. So they have a special unloading places. And during the operation, we also have guidelines on disinfection to all of those garbages. Start from July the 21st, as of yesterday, in total, we are able to handle 203 tons of garbages coming from the risky areas. So that is the current situation. If you have any suggestions or requests, please dial 12319 to reach us, and we will provide all the necessary support to all of you. That is the end of the Q&A session. Once again, thank you for your support. That's the end of the press conference.